All right, so I have the great pleasure here of chatting with Dr. Brandon Klein. Dr. Klein is a current sports orthopedic surgery fellow at the University of Pennsylvania, previous ortho chief resident at Northwell. Dr. Klein's had a lot of experience advising a ton of students along the way. He's very actively involved in medical student mentorship, advising, developing educational resources, and working with a ton of students over here at MatchPal. So I'm really excited to interview with him and chat with him about what, works for orthopedic surgery applicants. Dr. Klein, thanks for joining us today. Why don't you tell me in all the experience that you've had working with students, what's the single biggest mistake that you see fourth-year med students when they show up on day 1 week of their bio?
The biggest mistake is the students often feel too comfortable, and I think that that's kind of a turnoff to many of the residents right off the bat. And that can be portrayed in many different ways, whether it's with interactions just with the students while you're around the residents, or interactions with the attendings. And you see that a lot where students come in and they're too comfortable, and I'm not sure if that's experience on a previous rotation or having some connection to the program, especially if you've done a research year. I think those things kind of set you up for feeling too comfortable when you're starting your rotation.
I agree. I think students hear the advice pretty often of you want to be someone who's well liked, you want to be someone who is a part of the team, part of the crew, but at the same time, I think maintaining that professionalism is very important, and you have to know your place as, a student.
Yeah, I think pick and choose your times that you can add value to the conversation and interject. But yeah, definitely be cognizant of when those occurrences are happening.
You're a med student, you already made it to the point of you're pursuing orthopedic surgery, you're an MS4, you're done with your STEP exam, you're about to start your first away rotation. What should that person be doing the weekend before they start to make them stand out?
I think the biggest thing is utilizing your resources, because when you have students that ask questions that are publicly available on the website, or things that they could have asked a previous rotator, it's kind of a little bit of red flag that they didn't do their due diligence heading into the rotation. So I think if you have a weekend between rotations, is quickly review their website, know the general names of the hospitals that they work at, so you can be more comfortable and familiar when the residents are talking. If you have any sort of connection to somebody who's rotated at the program before, for any insight on how the attendings are, and some attendings are a little sharp, and if you know that ahead of time, it could help from throwing you off and putting you in a bad situation. And then besides that, I think constantly reviewing the same orthopedic basics and orthopedic trauma topics. Even if you are a few rotations in and have been asked consistently the same questions, the amount of knowledge that you can gain over your orthopedic rotations is tremendous. And as you get farther into other rotations, the expectations for you knowledge-wise tend to increase. So make sure you're constantly reinforcing the basics and then progressing forward to expand your knowledge base.
Absolutely. So people got to do a lot of this diligence and homework beforehand.
Yeah, I just think it puts you in a tougher start in trying to get first just adapted to the program and how things are on a day-to-day basis. I use this quote with a student who was rotating. The basics of orthopedics is hip fractures, and that's something that we expect you to know the complete treatment algorithm from July 1st of your audition rotations. So I've said in the past that students who come in and don't know that information, at least the basics, some of the terminology, just shows that they didn't put in any effort beforehand to study orthopedics. So I've said that not knowing hip fractures comes in is almost a sign of disrespect to me as a resident. So definitely a lot of expected knowledge that you're supposed to obtain on your own, and then gradually increase that throughout the season.
Yeah, and I think this is one of the things that makes ortho a little bit different. It makes ortho a little bit of a more rigorous and intimidating field to go into these OAs compared to other fields where either you already had a little bit of exposure, you already got the basics during MS3, or maybe the specialty a little bit more room for education in the beginning. So orthopedic residents are notorious for working pretty hard. They're really busy, and I think that coming in with that ground level knowledge gives you a better chance of leaving a better impression overall. That's what it sounds
absolutely,
like.
Yeah.
So I think with all that being said, you've probably seen over 100 students rotate through your hospital doors alone, not to mention the many countless of others that you've worked with remotely through various educational symposia and advising roles. What ultimately led you to wanting to produce the Ortho Bootcamp that we created with MatchPal?
So when I was a medical student, there were two students years ahead of me who made an effort to provided that guidance and mentorship to me. So it was something that I always wanted to do once I was established during residency and able to do the same. So my co-resident and I, Luke Bartlett, we wanted to have a farther reaching basis to try to provide the material consolidated in a single place. We thought it would be helpful for students to just have general access to the information that we're trying and to share to prepare you.
I think having one place that's like super accessible, students can learn on their own the weekend before the rotation starts, everything that your chief resident is going to want you to know, I think is just like a huge value add to showing up prepared, showing up ready to answer all those notorious PIMP questions that surgical subspecialties are known for. I think that if you don't really know what you're doing, it's very hard for anyone to trust you with even the smaller med student type tasks, right? When you were putting together this boot camp, what was the structure? How do we break it down?
Yeah, so we wanted to make sure we started off with a section that basically covers orthopedic implants and fixation type, as well as just general terminology for orientation and in regards to imaging, and discussed x-ray review. The majority of consults and pathology you'll see in the hospital is probably going to be trauma, and those are the commonly pimped questions, knowing injury patterns based on the x-ray, knowing the classification, and then the treatment that corresponds to that classification, as well as any other complications associated with that injury. So what we wanted to do was make sure that we provided a comprehensive upper extremity and lower extremity trauma review. And then after that, we were able to put together short videos on many of the orthopedic subspecialties, hitting on kind of high yield terminology and commonly pimped topics. We then put together some just general pearls based on our experience of observing students and try to give general rotation advice. And then throughout the course, we were able to incorporate over 50 multiple choice questions, which were written by Dr. Bartlett and myself. These questions emphasize the high yield PIMP facts that are asked. Some of these questions require you to read x-rays to be able to answer the questions. So they're more second or third order questions. And we feel that if you know those questions pretty well, this gives you a good foundation after taking this course to start your rotations.
No, I love that. This is like a really comprehensive learning tool. I really think there's no other way to put it. You have literally the foundational aspects, I think, of every facet of orthopedic surgery that can be expected of you to know at the MS4 level. But I have a question for you. What makes this different than something like ortho bullets, which I know is really commonly used?
So there's a ton of resources out there for preparing for your rotations. But based on our experience, there's definitely topics that are repeatedly tested each year. We try to focus on those. This provides a very direct view at what you need to do well on, because some of those resources can be overwhelming when you look at the amount of material and content in ortho bullets or even some of these pocket pimped type books. It could be difficult to know where to start, especially without having a strong orthopedic background. With med schools kind of not putting a ton of time into teaching the musculoskeletal system in orthopedic surgery. So I think that those provide a strong foundation.
Love that. Yeah. And I think all in all, we ended up with about 5 hours of content, over 50 practice questions, and it's all self-guided, obviously really nicely organized. There's no video that's longer than 20 minutes. So you can listen to it while you're driving. You can just kind of go down the list on a Sunday off before your rotation, or even after your first day or two, just to kind of get aware of things. And obviously you always have access to the course to go back. Let's say you see a case and you want to refresh on that topic, or you want to prep for a case that you're going into the next day. I think it's a really valuable thing. But I think ultimately what makes it different from some other resources is that it's catered to the MS4 level and it's really concise. I think there's also a ton of really valuable pearls that you guys dropped for how students can stand out, behaving on the rotation, adding value to the team. These kind of subjective pearls that you just can't really get unless you've seen a lot of students rotate through the doors. So I feel like that's another really valuable element that the students get, in addition to, of course, the actual medical jargon, the imaging, the terminology, the devices, etc.
Yeah, absolutely. I think having a very recent chief resident perspective in a program, we have a tremendous amount of students that have come through and rotated with us. So these are definitely the high points that we look for.
I love that. Yeah, well, really excited for everyone to utilize it this season. We thank you a ton for putting it together. Just a couple of rapid fire questions before we wrap up the call. What's something that a med student can do to add value to the team without scrubbing it?
So I think for orthopedics, you do spend a lot of time at most programs on the floor. Usually there's not enough people operating for all the students to be scrubbed in. So a lot of times you'll be assisting. The amount of level of assist really varies on program to program. I think that the biggest thing you can do is trying to pay attention during morning sign out and when they're talking about tasks for individual patients and figuring out what tasks you can do to save the residents time, whether that's going to grab supplies to do a splint change or dressing, and that's going to be different based on each rotation. So over the first couple of days, kind of feeling out what the residents want you to do and how involved they'll allow you to be.
Love that. Now, let's say you're a med student, you're just seeing this, you're already in the middle of your first sub-I, or maybe you're about to start your first sub-I tomorrow. Is this still worth getting?
Yeah, I think the course is definitely worth getting. If you came in a little unprepared to your rotations, it can be intimidating stacking up against other students who might have had, a little bit more guidance than you, and their knowledge base might be a lot more than yours. I think this course allows you to catch up pretty quickly. This should get you up to speed with the majority of things that you'll be asked about during the rest of your audition season.
Love it. Thanks so much, Dr. Klein. Thanks for putting it together, and thanks for taking the time to answer some questions today.
Awesome. Thanks, Dan.